Hi, my name is Diana Shannon, and this is my Deliverable 1 project for causes and consequences of events in healthcare. This is a timeline and a PowerPoint timeline for Rasmussen College. So we begin in the 1900s. The American Medical Association becomes a national force. In 1901, the AMA recognizes as a national organization, so it's becoming really big. The memberships rise from 8,000 physicians in 1900 to 70,000 in 1910, so quite a big jump. This is also when organized medicine started to begin. So approximately 300,000 members as of 1999 for the American Medical Association. So it's pretty amazing how it began in the early 1900s and where it is today. So as we move into the 1910s, we're starting to look at American Association for Labor legislation, also known as the AALL. This was also the start of social insurance. The argument to have health insurance is gaining support as medical expenses start to rise and people are not able to afford to get regular health care. American hospitals are also starting to become teaching institutions to teach the next group of physicians coming up, and so on and so on. So they actually work on patients like you see today with interns and stuff to do their education. They're using medications to treat pain in hospitals, which is new. And a modern bill was produced in 1915 to adopt a health insurance. So this is all starting to take place. So now we're getting into the 1920s. Health insurance, there's a rising cost of medical care. There's a growing cultural influence, and we start to see penicillin. So the cost of medical care is becoming evident. Health insurance is becoming more accepted. General Motors is the first company to do a company-wide insurance coverage for their employees. So Metropolitan Life was the carrier, and they covered up to 180,000 employees for General Motors. We're starting to see that rural health facilities are inadequate for medical care. You really need to be in the busier cities and things like that to get quality care in the bigger teaching facilities and hospitals. They did discover penicillin, but it will not be used for 20 years. But they did discover it, and they've started to do research and lab testing and things like that for penicillin. Physicians are starting to become more prestigious in the community. They're higher in the community. People are starting to see them as very, very important parts of the community as they make more money and things like that. So in the 1930s, we see the Great Depression era. The Great Depression proved to be a great emphasis on unemployment insurance and retirement benefits, because during the Great Depression many people lost their jobs. They were laid off from their jobs, so they needed some sort of money coverage during that time to help supplement their income. So unemployment insurance became known. And also people that were of retirement age were starting to look at retirement benefits, which is where Social Security Act was passed. So this is where we see this happening in the 1930s. Blue Cross Blue Shield begins offering private coverage for hospital care. I didn't realize that Blue Cross Blue Shield, which is the insurance coverage I have, started all the way back in the 1930s. I didn't realize it had been around for that long, so that was pretty interesting to know. Also in the 1930s, we see President Roosevelt come into office. His administration began really pushing health insurance, and this actually started to cause a lot of political conflict, as we even see today. So I guess things really haven't changed that much in that way, because we are still seeing political conflict and controversy regarding health insurance and what we should and shouldn't be doing with that. This causes a lot of government officials and internal conflict in the government. So now we are in the 1940s. President Truman is coming into office. We finally see penicillin being used. They've discovered that it can be used as an antibiotic to kill bacteria, so it's used quite often. Prepaid group health care is beginning. So people are starting to pay for group coverage. More companies are beginning to offer health coverage to be more competitive, so it's becoming part of the package when you start a new job at a company. If they have a good benefits package, more so than another company, then they're more, marketable and desirable. Truman offers a national health program plan. We're continuing on with the AMA and Truman's plan. The American Medical Association denies Truman's plan for a single system to include coverage for all Americans. They call this a communist plot by the House subcommittee. So it's definitely turned down, and we're still fighting that fight today on a universal coverage system type thing, and whether it's appropriate and how we can do it to meet everybody's needs, how it can be not as expensive for people and more cost effective. So it's amazing that we're still dealing with that today, and we still haven't come up with a really, really good plan. So now we're hitting the 1950s. Insurance is divided by social class. At the start of the 1950s, healthcare is 4.5% of the gross national product. Services for the poor are firmly established as a federal responsibility, so they're starting to think of things like Medicaid. The healthcare system divides into private insurance, like Blue Cross Blue Shield, for those that can afford it, and welfare services similar to Medicaid for the poor. Continuing on in the 1950s, there's more insurance proposals that are unsuccessful and medication changes. Different plans are underway for different approaches regarding hospital insurance. So far, none of them are succeeding. They're having a hard time in the 1950s coming to one decision on how to do hospital type insurance. There are many more medications available at this point to treat infections, diseases, even conditions such as arthritis, glaucoma. So there's more and more advances to help people live a more quality life. And this is when vaccines start to become introduced too for childhood diseases such as polio. So we're making really big strides there in getting rid of these childhood diseases altogether. They even succeeded with the first organ transplant. So the 1950s was really becoming a great influential decade for modern medicine. So now we come into the 1960s. Insurance is not affordable. There's multiple insurance companies competing against each other, raising the costs. The price of hospital care has doubled in the last 10 years. Those that are outside the workplace, especially the elderly, are having a hard time affording insurance. It's becoming a huge problem. More than 700 insurance companies are in business selling health insurance. And also at this point, there's a massive doctor shortage, which is leading to the expansion for education and health professions. So now, also, we're starting to see high cost of medications, and President Johnson comes into administration. Medical insurance companies begin to endorse high-cost medications. So medical insurance companies are wanting people to be prescribed these medicines. President Johnson is introducing Medicare and Medicaid into law, so they're finally calling these government-funded programs Medicare and Medicaid. The number of doctors grows from 55% to 69%. So now we are entering the 1970s. This is when President Nixon comes into office and the high rise of healthcare costs continue. President Nixon renames group healthcare plans health maintenance organizations, or HMOs, which they still are today. Healthcare costs are skyrocketing due to Medicare expenditures. So Medicare and Medicaid come into play, which costs a lot of money tax-wise, and also they don't reimburse quite as much as private healthcare plans do. So they're starting to see the costs skyrocketing. American medicine has now seen a crisis in the United States with the rising cost of health care. We also see in the 1970s the war on cancer and women in the medical profession. So President Nixon's plan for national health insurance is rejected, again, for a national plan, by labor unions and liberals. Nixon's war on cancer gets research funding, which begins the research funding for cancer. Women are actually entering the medical profession. They're rising from 9% of women in the profession in 1970 to 25% by 1979. So this is a big jump for women in medical care. So we come into the 1980s decade. This is hospitals and corporation time. Hospital systems begin to integrate with corporations, and there is a shift toward privatization and corporatization in healthcare. This is also when President Reagan comes into office and his reign over the healthcare industry. Medicare shifts to payment by diagnosis instead of by treatment under President Reagan. Private plans begin to do the same thing and follow suit. So there's a lot of growing complaints by insurance companies regarding the traditional fee-for-service payments to doctors. They're arguing about how much they should charge, because at this time doctors can charge what they see fit. So they're going to start moving towards a traditional fee-for-service. Capitation payments to doctors becomes more frequently used. So then as we enter the 1990s, healthcare costs are continuing to rise, and managed care as well. Healthcare costs are continuing to rise at double the rate of inflation. Managed care helps to moderate the increase in costs, so there is some help there. By the end of the 1990s, there are 44 million Americans, or 16% of the nation, with no health insurance coverage at all. So this is becoming a big problem. Also in the 1990s, the Human Genome Project is underway. 100,000 genes are identified in the human body. This is very helpful for research on diseases and genetic diseases. Almost 140,000 people in the United States have HIV and AIDS. It was a growing problem in the 1980s, but now that we're in the 1990s, we're really starting to see the effects of HIV and AIDS, as many people have had it for up to 10 years. There is a 60% mortality rate at this point in the 1990s with HIV and AIDS. So as we enter the 2000s decade, the beginning of the turn of the century, healthcare costs and Medicare, the healthcare costs are continuing to rise. Medicare is considered unsustainable, and research begins on how to rescue Medicare program. Also in the 2000s, pharmaceutical companies are taking over. They're beginning their marketing at different hospitals and clinics. Direct-to-consumer advertising for pharmaceutical and medical devices become popular. We've seen them all at clinics and hospitals, those men and women that come in their suits with their little tote bags with their medications that they are trying to get the physicians to give out as samples and to prescribe. This is causing a lot of competition between drug companies and also causing a lot of higher cost medications. Generics are starting to become more and more popular as people are not able to afford the name brand drugs that the pharmaceutical companies are advertising. So a lot more generic medications are also being prescribed. So we see in 2010, Obamacare is starting. They expand access to health insurance and to reduce costs. That is still continuing today, even with Trump in office, with the Trump Care, where they are trying to be able to provide coverage for every individual that is affordable.